Fears among thousands of Iowans who could be at risk of losing Medicaid coverage are growing. Republicans are pushing a bill that would require Iowans to work at least 80 hours a month to qualify. Local 5's Megan McPherson spoke with one Iowan who believes her work may not fit that mold.
This legislation only applies to able-bodied Iowans and does provide exceptions for specific groups. But the language surrounding volunteer work is causing concern for some. Kathy Burns has transformed the yard of her Sherman Hills home into an urban farm.
They're just getting started for the day.
Collecting eggs from her backyard flock, honey from a colony of bees, even using fresh fruit and produce from the garden for salads and baked goods, and teaching other people to do the same.
We are busy teaching people to grow food.
Burns and her husband Ed both work long hours here, but as a nonprofit, they're not earning much.
I don't get paid anything. I have no income. In fact, our urban farm is operating at a loss right now.
Living below the poverty level, Kathy qualifies for the state's health and wellness plan, receiving free health care. She's just one of the 700,000 Iowans on Medicaid, and one of 32,000 who could lose coverage next year if proposed legislation becomes law. Under the bill, recipients would have to work at least 80 hours a month to qualify, with some exceptions. Burns worries her work may not qualify.
I'm feeling quite at risk of losing my benefit if the bill as written is passed, because they've removed the volunteer portion of that.
Estimates from the nonpartisan Legislative Services Agency show this would save the state more than $3 million in the first year and more than $17 million in the second year and years after that. But economist Mark Immerman believes that those savings will cost the state's economy in other areas.
$17.5 million a year for the state budget turns into about $151 million in health care expenditures that won't be made in the state. That's big.
His economic model predicts the state losing more than 1,000 jobs, mainly in the healthcare industry.
They think they're saving $17.5 million. They're going to be surprised.
Immerman was also surprised to learn that the Department of Health and Human Services, which runs the system, did not provide any information to LSA on fiscal implications of the bill. A member of the agency tells Local 5 that they did not receive a response to multiple information requests from HHS.